Good morning, everyone. I'm Sayukta from Beautiful Spotless Skin team. I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown color patches on their face. They seem like freckle, like spots forming large flat patches. This is nothing but melasma. Melasma is a very common chronic skin condition in India. According to a study conducted across 4 Indian cities, it reveals that more than 80% of population present skin color heterogeneity on the face, irrespective of face and gender. This mainly results from hyperpigmented spot or melasma. Indian skin tone more prone to pigmentary disorders. It occurs mainly in women, 90%, and 10% of males of all ethnic and racial groups are also affected with it. Around 20 to 30% of 40 to 65 years old women present a facial melasma. Melasma and hyperpigmentation, generally ignored as sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of the common hyperpigmentation issue. This can lead to frustrating setback in treatment. To avoid all these hassles and to keep you informed, today we are here to know about management of melasma from an expert. So let's connect today with our skin expert, Dr. Tanuja Tamhankar, a consultant dermatologist, cosmetologist, and hair transplant surgeon live from Pune to make us aware on management of melasma. Dr. Tanuja is the founder of Novo Grace Skin Clinic at Pune and have more than 15 years of experience in this field. Today, Dr. Tanuja will share her expertise on management of melasma. A very warm welcome to you, Dr. Tanuja.
Thank you. Thank you very much.
It's a pleasure to have you with us. And today, as we are going to talk about a very common problem with Indians, and that is melasma. So, first of all, doctor, we would like to understand what is melasma.
So, basically, as you well said, that melasma is a pigmentary disorder of the skin, especially the facial skin is the most commonly involved area. But there are other areas also involved, other sun exposed areas are also involved, but very rarely, but facial skin is most commonly involved. It is basically a disorder of the skin as such, the skin melanocytes, where there's excessive proliferation, there is the pigmentary cells, they proliferate, and nowadays there are many theories that it's not just the pigmentary cells, it is the vascularity, there is chronic inflammation involved, there is the mediators are involved in the skin so that the pigmentation and everything it increases. And it's not just the pigmentation, there is the elasticity of the skin is also involved, the vascularity, the vessels are also involved there. So basically it's a disorder where it is a combination of multiple factors, not just the pigment which is seen as a pigment. So basically the management also depends how the pigment is. What is the etiology? What is the pathogenesis?
Right. Now, as now we know what melasma is, we would like to understand, doctor, what causes melasma? What are the factors responsible for it?
So, if we see largely, melasma is majority of times it's seen in females, but males are also involved. So one of the major factorial reason which is causing melasma is the sun exposure. So, and that is the main line of treatment whenever the melasma is concerned. The other factors are in females like pregnancy. Majority of females, they encounter melasma whenever they get pregnant. In pregnancy, patients taking OC pills or estrogens, all hormonal treatment, they are like prone for melasma. And ethnicity, genetic factors, like some people, they are genetically prone, their skin is prone for getting melasma and pigmentary issues, so they will get it. So by and large, if we see 70% of times it is the sun exposure, and majority other 30% is like the minor things which affect melasma.
Okay, doctor. And along with melasma, another term which is very common to our ears is hyperpigmentation. We would like to know, doctor, is there a difference between melasma and hyperpigmentation, or are they the same?
Yes, as I told earlier, melasma is a disorder. Okay, it's a disorder as in there are multiple factors involved. The melanocytes are involved, the vascular factors involved, chronic inflammation is involved, the degeneration of the skin is involved. So it's a disorder. Whereas hyperpigmentation is just the pigmentation of the skin. Anything like, even if ant bite happens and my skin gets involved, so hyperpigmentation in after burns, after pimples, after any procedure, if the skin is burned or any inflammation occurs in skin, then it will cause hyperpigmentation. So hyperpigmentation is a general term which is there, which even after tanning of the skin, after like people who are going to Goa and they come with the tanning of the skin, that is just a hyperpigmentation. Or a patient can have a pimple and then pigmentation because of the pigment, that is hyperpigmentation, which is easily removable. But as I said earlier, melasma is a disorder and it's an endogenous thing. So it's not that something has happened from outside. So grossly, if you see, melasma is endogenous, which is happening because of the problems inside your body, and hyperpigmentation is exogenous, which is happening from outside.
Okay. And doctor, any signs of melasma? I mean, what we can understand is that anything which is dark in color, any patches, freckles, etc., is, we can, term it as melasma. But still, anything specific that says that, okay, yes, you are suffering from melasma.
So basically, whenever we see any patients, so majority of times any middle-aged females like who like get pregnant in second trimester, they get pigmentation around their cheeks. So that is most commonly melasma. There are other areas also. This is the cheek area which is commonly involved. Then forehead area, nose area, and chin area. So these are the patterns, and over the mandibles. So because depending on the type of pigment, like if how the pigment is, whether this is homogeneous, heterogeneous, whether this is a dark pigment, especially when we come to the types of melasma. Basically, when we say there are majority of time there are three types of melasma: epidermal, dermal, and mixed kind. Epidermal is when the pigmentation is over the epidermis, this is the superficial layer of the skin. Dermal is when the pigment is in the inside, like in inner layer of the skin. And mixed is when both types are present. Okay, so by look also we can make out the epidermal pigment is a bit darkish kind, the darker color pigment is there, whereas the dermal pigment is a bit bluish type of pigment, and in mixed type both the type of pigments are present. So depending on that, we see whether whether the patient is having melasma, and it's a very spot diagnosis. Usually we don't need to diagnose because patients only tell us that they are having melasma. It's such a classically seen, and especially over the malar area, majority of time it comes. So it's very classically seen, and patients only tell us, and then the treatment part we have to do, and we have to tell the exact pathogenesis of the problem, and then we have to treat it.
Right. So it's not very tough or hard to diagnose. Just by looking at it, or some investigation, you can tell that yes, it is melasma. Now the thing is,
one more thing I want to add, like to differentiate between the epidermal and dermal, we can do Woods lamp examination. Woods lamp examination in that epidermal, then to differentiate between the type, because the treatment will be different. So we need to differentiate whether this is an epidermal melasma or a dermal melasma. Nowadays, dermatoscopies has been done, and they are like trying to differentiate between the vascular component. If the vascular component is there, the treatment line is different. If it is because of the chronic inflammation, the treatment line is different. And if it is plainly pigmentary kind of melasma, the treatment line is different. So depending on the type of melasma, depending on the investigations, but we do the physical examination I'm talking, we have to come to a conclusion, and the treatment line depends on the kind of melasma you are having.
Right. So with the due diagnose, you can find out which kind of melasma it is, and then the treatment line of treatment will depend upon that. Now we would like to know, doctor, how do you treat melasma? What are the treatment options available?
So as I said earlier, like the treatment will depend the kind of melasma the patient is having. Whenever a patient comes to us having melasma, we have to take a detailed history. So nowadays, patients usually don't come to us directly. First, they go to some medical stores or they self-apply things, and then after, if the complication happens, and then they usually turn up to us. So we have to take a detailed history. We have to ask what all things they have applied, how is their lifestyle, how they are, how much is the sun exposure, their occupation, and then after that, coming to a conclusion that depending on the occupation, also our treatment lines will be different. So whether we need to stick to just the medical line of treatment or the treatmental part also, we have to see. So by and large, whenever the patient comes, the most important factors which we need to take into consideration is first is whether they have taken treatment before, what all creams they apply, what all skincare routine they follow, and after that, their occupation, how much they're exposed to sun. A person who is very much exposed to sun, we cannot give very harsh treatments for them, because obviously they won't be following the sunscreen routine properly, and then they will land up in problems. So first, counseling becomes an important part, and there are multiple treatments, multiple ways we can treat it. First is like medical ways. In this, the most earlier when we were learning that time, most Klingman formula we used to use, that is the retinoid combination, hydroquinone, and steroid. So that was the kind of treatment we were giving, but there were few problems associated with that, especially with steroids. So patients were having like thinning of the skin. They were their skin was they used to get very sensitive. And the moment you stop the cream, the melasma used to come back again, which nowadays, majority of times we are not practicing using steroid, because whenever the patient land to us, they've already used steroids and all. So we prefer not to be dependent on a thing which will give a temporary solution, not a permanent solution. So what we have to tell the patient, most importantly, that this melasma is, there is no cure for that, but we can keep it under control. So there is always a control for that, but cure is not there. That thing we have to tell the patient on the first session itself. And because patient comes with a expectation that within few months this will go. There are many treatment modalities available, like retinoids, hydroquinone, niacinamide, arbutin. There are many glutathione nowadays. Many drugs, azelaic acid. So these glycolic acid. So these are the topical creams which we usually use. And after that, the maintenance phase, when we have to ask the patient to use that, along with that, we have to go for treatment based. In treatments, we can do chemical peels, we can do lasers for them, and with that, their melasma comes into control. So always, most important thing we have to tell the patient is usage of sunscreen, because since 70% of times it is because of the sun exposure. So most importantly, we have to tell them that if you are able to apply sunscreen properly throughout your life, then you can think about the control part. If that is not possible, it becomes very difficult, because 6 months we will invest in treating the patient. After 6 months, patient will go and not use sunscreen properly, then it is of no use.
Right. And you very rightly said that whenever most of the time patients come to you, they have already applied something on their skin or tried something on their skin. Now, what happens, if we see anything wrong going on our skin, then first we'll try to quick fix it with some home remedies. We'll go for some dadi ke nuske, nani ke nuske, or we'll go to any chemist shop and ask the chemist ki hamare skin pe dekho na aise patches ho rahe hain, kuch cream de dijiye. So over-the-counter medication, home remedies, what's your take on these?
Yeah, definitely. Actually, should be the most important question of the session, because nowadays many a times we try to solve or resolve the side effects associated with the treatment available, like outside or through social media or through YouTube. People are telling they apply whatever comes to their head to apply this, that, whatever. So that is really causing a lot of side effects in patient, okay, especially when they are applying steroids, especially when they are applying irritants. They don't know that how your skin is reacting, what all precautions you need to do or you need to take while using the treatment, Okay, so many times we also give the same treatment, but it gives a good result because we tell them what to do, what not to do. That what not to do is more important than what to do many times, because nowadays social media and everything is so everyone has access to everything, but how to use it in a proper way, only a person who is like trained in that can tell you, and you have to follow that. If you do things on your own, then it becomes a problem, especially pigmentary disorder where melasma kind, where steroids and all, immediately when you start using steroids, your skin will glow like anything. You will get such a nice result that you'll just love it. But problem starts whenever you stop it. After that, everything starts. You get pimples, your skin is very irritable, you are not able to maintain a good skin. It becomes very, wrinkles come up, skin become very thin. So lines and all are seen. So these are the few things which really are bad for the long term. So you have to avoid that. So obviously the home remedies, if if you are using something like the heat, turmeric and all, that is okay. But many people are not just staying to that. They are like going away. They are using few irritants, few things which are not very good for skin, and then it is the main problem area which we encounter.
Right. Exactly. I have seen people going to the extent of rubbing lemon on their face, saying that,
Yes,
vitamin C is good
causing
for our
pain
skin.
dermatitis,
Or
and then it will land up to us.
exactly. The irony is that, we go for home remedies or over-the-counter medication first, and when the condition worsens, that's when we land in front of doctor. It should be vice versa. We should go to the doctor first. If we want to try anything, we should first seek for an advice from a qualified dermatologist. So viewers, please go to a doctor, an expert, qualified dermatologist in case you have any issues on your skin, and don't do anything on your own. It will worsen the condition. I'll also pick some of the questions that we are getting from our viewers. Shruti Nigam is asking, what is the most effective treatment for melasma?
It's difficult to answer that because every individual is different. Every skin type is different. Kind of melasma is different. As I told earlier, there are pathogenetic factors, whether this is a vascular melasma or it is a pigmentary melasma or it is because of the inflammation. So we need to take into consideration of that and then come to a proper treatment according to the pathogenic, the cause of the melasma, and then we have to treat it. So for each and every kind of different pathogenetic mechanism, there is different creams are available for that, and we have to take into consideration of that. There's no one a thumb rule can use this and this will be over. It doesn't work that way in medicine,
Right.
especially.
Exactly. There's no magic miracle that's going to
Miracle
happen.
is
The
not
only thing
magic.
you can do
Hopelessness is now
is
not poor. If one patient is getting a very good response with a particular thing, the next patient might not get it. So we have to try different things. So there's not one thing which, and as I told earlier, there's science behind it, that there are different pathogenetic mechanisms, and accordingly the drugs are designed according to that, and accordingly we have to prescribe the treatment.
that reminds me that many people follow their friends or family's prescription. For example, if I have acne, I'll ask my friend, okay, you also had acne and you went to some doctor, right? So please give me your prescription. I'll go and buy the creams and I'll start, self-medicating medication. How good or bad that practice could be.
No, definitely no, because as for acne or melasma or any other problem, the every individual will not be affected by the same medicine. So it's not one rule. That's what I told earlier.
Right.
So it's always we have to assess the main problem and then we have to treat it.
Right. And as you said, it's important to understand that the diagnosis or the causes responsible for that will be different. So, and we all are different persons. So, definitely, we need specialized treatment or advice, and only a qualified dermatologist can give you that. Ishita Jha is asking, how can I permanently remove melasma from my face?
As I told earlier, that removing permanently, we can control it. So we can do treatments, we can do lasers, we can do fields and all. We can, you have to be in continuously a constant maintenance regimen for reduction of your pigmentation. But there are few ways by which the pigmentation may come back again, especially sun exposure. As I really need to focus on the point of sun exposure, because what we have seen is, like, if patient is following rigorously following sun exposure routine, like repeatedly applying sunscreens and protecting them from the sun, and even one day if they expose themselves, then all the whatever we have done is on waste, because if the pigmentation comes, then it's again we are on the same level. Okay, so most importantly you have to understand that a strict sun exposure, strict sun exposure, we're not supposed to have sun exposure. And whenever we are going out, we have to use sunscreen. The effect of sunscreen lasts only for 2 to 3 hours, depending on the kind of sunscreen which we are using. And we have to reapply it. If we are like into spots and all, we have to again reapply within an hour also. And we have to use sunscreen even indoors, while using computers, while using mobiles, television, because these radiation are also not very good for melasma. And the most important thing, nowadays the indoor lighting are also inducing melasma. So you have to use sunscreen throughout your day and night. So while sleeping only, you have to like remove your sunscreen, and that is the most important thing for patients having melasma. If you follow that, 50% of the problem solves like that only. Okay, this is even patients tell us that the moment they sometime go out and then pigmentation increases, and after that it's like normal. So 50% is like comes helps, the strict usage of sunscreen helps a lot. So 50% of the problem solved there. And after that, there are like depigmenting creams available. We do many treatments, peels, we do lasers. We can remove it. That's not a big issue. But you have to be very careful, and you always have to be in maintenance treatment of the melasma.
Okay. So
just like
we can also
diabetes or something like that, like you get diabetes, you have to like, it's like nowadays that's not very true, but it's like getting a chronic disorder, which for that you have to continuously take treatments.
Right. So we can use sunscreen as a preventive measure. Like, for example, I'm 20 years old, I'm not having melasma right now, but I can, if I start using sunscreen at the right age, maybe I'll prevent having melasma in future.
Yes, you should. Actually, you should. And everyone should, like, you start using sunscreen, because nowadays it's not just about the melasma. There are other things also, like our environment is not very protected. Like the ozone layer, which was like UV rays filter, has been depleted. So obviously we are under stress of sun exposure induced dermatitis and other things. So it's always safe to use sunscreen. And the good news is, many people talk about that, what about the vitamin D synthesis? Nowadays, special sunscreens are also available, which will not hamper your vitamin D synthesis as well, so that you can use your sunscreen also, and you will not be in a fear of losing your vitamin D. So, and nowadays sunscreen has definitely have good, you can use good sunscreens.
I'm glad that you cleared the vitamin D deficiency myth forever for all our viewers. Now, because sunscreen is so essential, and you said that even if the name suggests sunscreen, it's not only protecting our skin from the rays emitted by the sun, but also from the other light sources, like the laptop I'm working in front of, or the lights we have at our house or office or wherever. And these all lights, etc., are harmful for us. Now the thing is, whenever we go out to buy a sunscreen, there are so many informations written on the box, starting from the SPF to its PA+++, or its broad spectrum or not, or etc., etc. So what are the things we need to look for?
Few things definitely. First thing which I want to tell, that we have to always look for a good SPF. 30+ SPF for our country is good enough. SPF not just depends upon the kind of SPF the sunscreen is having. It is also depending amount of sunscreen you're using. So if you're using adequate amount of sunscreen, that you don't need to go for 50 plus SPF. I think 30 plus SPF will be good enough for you. It's basically the sun protection factor which is there, and it is the property of the sunscreen. Then definitely a good boot star rating will also be, you should always see 3 plus boot star rating, and the other parameters also should be good. So basic, these are the factors which our patients don't know about that. And but only thing is, most important thing, you have to take a medicated, whatever it is, you have to take the medicated sunscreens, not the over the counter available products. That is one thing which you need to take care of. And other thing is, it's like sunscreen is a thing which you have to always use. It's not like for few days you will be using. So you have to see whether this is suiting your skin, whether you are your skin is getting very oily. It should be cosmetically elegant also. It should be you should be feeling light. You should not feel that something you're wearing on your skin or some sheen is seen on your skin. So there are many, and high, obviously most importantly, it should be cost effective. So there are many things which you need to think before using a sunscreen, which usually what we do is we prescribe sunscreen according to the skin types, how the skin is oily, and usually generally by and large majority good products, they are like safe one, which we don't need to think whether the quality wise usually good products are safe. Only thing which we need to see is like how the consistency, how's the skin type of the patient, and accordingly we prescribe skin sunscreen, or we are giving some co-prescription along with that, because if a thing is making your skin oily, I cannot give you oily sunscreen again. So we have to judge depending on that. And the coming to sunscreen, there are like broadly there are two kinds of sunscreen: organic and inorganic. Usually, if you see that inorganic sunscreens, they scatter the light. Okay, so they're not absorbed in the skin. They work by scattering the light, and these are like zinc oxide is the most commonly available sunscreen. Zinc oxide and calamine, titanium oxide, iron oxide. So these are the few things which are available in the market. Majority of time it's zinc oxide based, and earlier they used to give a sheen to the skin. Nowadays, because of they've reduced the size of the particle, the sheen is not there, and it is more better sunscreen which is there for like especially children and people who are having allergies of skin or skin irritation. So these products don't cause the irritation of the skin. If we come to the organic sunscreen, these oxybenzone, tenozops and all, these are also excellent products, and they get absorbed in the skin and they work by filtering the light. So, but only problem with them is they can cause irritation. They can, if the skin is irritable, then they cause irritation and all, and maybe allergies also. So we have to make sure that patient is not allergic to sunscreen. Other thing which we need to see is always, it's like combination works best. So always if we see in the sunscreen thing, there are always different kind of products which are available. So there has to be a balance between a organic and an inorganic sunscreen, so that what happens is both the kind of protection is being taken care of, the scattering part also, the absorbing part also. So this was about in brief about the sunscreens. And definitely patients are not bothered about how good or bad the sunscreen is. Patients are only bothered after applying sunscreen how they are feeling. That is the most which I have seen in my practice, that if they are feeling good after applying sunscreen, they will use it. Okay, if the skin becomes very oily, if their skin looks very bad after, or many times patients complain that chehra bahut kala dikhta hai sunscreen lagane ke baad, which is not acceptable. So since you have to, we are telling them they have to use it for throughout their life, and if they are after applying they are not happy, then there's a major problem. So that time the consistency, how the feel of the sunscreen, whether this sunscreen is making your skin oily, whether this is a gel based or water based or petroleum based, we have to see, and accordingly we have to prescribe that.
Yeah, you're absolutely right. People come up with so many complaints about sunscreen. I look very oily, or I sweat a lot, or I look very patchy, or the white cast is an issue. But as you said, it's important to choose the right kind of sunscreen as per your skin type. So many formulations are there as per your working condition and your skin type. You can choose the right one And for that, again, you can seek the advice of a qualified dermatologist. So go consult with your dermatologist. There are so many, formulations, etc., available in the market, or the medicated one we are talking about. Just seek the advice from your dermatologist and go and buy the right one as per your skin type and your working condition. You also said, Dr. Tanuja, that it's important to apply sunscreen. Reapplication is equally important, and the amount you are applying on the body parts exposed is equally important. We would like you to shed some light on that as well.
Yeah, there's a concept like a teaspoon. If you're applying to the face and hands and all, then the chest, the exposed chest, then I think half a teaspoon will be enough. And if you're applying to the back, the legs, and everywhere, then one full teaspoon is there. There's one more concept of fingertip unit. So this is the half of your fingertip is the quantity which is sufficient for a palm area. So these are the two things which determine the quantity of the or any product or even sunscreen or any other product which should be used is determined by that. So if you're applying that I think that should be enough. Basically, if you're applying, especially in sunscreen, if you're applying less quantity, what happens is just SPF comes down, and it should be actually if we see theoretically it should be 2 mg per centimeter square, the amount. So if we are not applying adequate amount, the SPF comes down, the protection factors come down, and then it's not as effective as we want it to be.
Right. And reapplication, I mean, and how many times we need to reapply the sunscreen?
Yes, actually, ideally, you should reapply your sunscreen every 2 to 3 hours. 3 hours is a good enough time where you should reapply. And nowadays, there are sunscreen which gives protection up to 8 hours, but I don't rely on that. And I usually ask my patients to reapply the sunscreen, most importantly. And if you are after any physical activity of sweating, or you are in a water sports, or you are swimming and all, that time every hour.
Okay, I'll take few more questions from our viewers. So Ananya Pandey is asking, what is the gold standard treatment for melasma? What is the gold standard treatment? Yeah, what is the gold standard treatment?
I'll say if we come to gold standard treatment, I'll say it should be a mixed treatment where you are applying hydroquinone and retinoid based treatment we need to give initially to subside the lesion. And after that, we have to give a maintenance treatment along with along with sunscreens, along with antioxidants, along with treatments like chemical peels and lasers. So it always has to be a full basket of the treatment which should be given. Not definitely we have to counsel the patient regarding maintenance treatment, because 6 months the patient stays with us, taking everything, following everything. After that, patient stops everything. So that should be taken into account, that you are not supposed to stop everything. You have to take maintenance treatment in the form of something or the other, some maintaining cream. You have to, the safer ones which we are using, the safer ones we have to use, and so that your melasma is under control.
Okay. Vaishali Thakur is asking, what vitamins can I take to help with melasma?
Vitamins, as far as nutraceuticals are concerned, vitamin C is very good for collagen development and reduction. Antioxidant, basically, beta carotene, vitamin E. It has to be a full basket. Basically, you should, as in, if you are deficient in B12, then you have one type of skin problem. If you are deficient in one vitamin, so it's always, you should always look for good vitamins. But by and large, I'll suggest that vitamin C and glutathione, they work very excellent in melasma, pigmentary disorders.
Fair enough. Okay, so Prerna Roy's question is, if I have melasma, does that mean I'll get thyroid?
No, actually, hypothyroid people, they have more chances of getting melasma, not too many, but as compared, if you compare a population of hypothyroid people and normal people, then maybe hypothyroid people maybe have a little bit chances of getting melasma. But if you're having melasma, you will get thyroid. It's not true.
Okay. Now, Sneha Verma is asking, can melasma go away on its own?
Less likely. if you are
Because
protecting
many times,
yourself
people
using,
wait. People say that it's a sign of aging. I'm bound to have it.
so as I said, it's an endogenous problem. Genetic factors are involved. If you're using a good sunscreen, and if you're not exposing yourself to too much of sun, maybe after your hormonal imbalance goes away, like if it is because of the hormones, like because induced because of OC pills or any estrogenic drugs you have taken. If it is because of that, maybe your pigmentation might go down. But and if you're protecting yourself to in sun, and but the thing is, if you're not protect yourself from sun and all, then again it will come back.
Right. So protection, you need to protect your skin anyways. I mean, before melasma, after melasma, or even during the time when you're going through treatment, protection is the key. Now, Pooja Pandit is asking, how long will it take? Will it take the medicines to take or show its effects?
Usually 3 to 4 weeks.
Okay, so usually 3 to 4 weeks. Now, many times, I'm sure you must have come across such patients as well, where they have started taking the medication, etc., and the moment they see that, okay, I'm getting some effect or no effect, they'll immediately change the prescription or the doctor, or they'll keep on switching from one to another, and I mean, they are never satisfied with what's going on. So does because treatment length may take time or may become lengthy in melasma. So having patience is equally important.
Yes, definitely. Sticking to the treatment, sticking to your doctor is the most important thing. First thing, you need to trust your doctor, whoever it is. And after that, sticking to a particular treatment plan, whatever the doctor has given. Usually, if we are not getting results, then we switch to treatments like beams and lasers and everything. So, by one way or the other, we can definitely treat it. It's not that we are not, we cannot treat that, but only thing is, most important, patient have to understand this is a chronic disorder. So understanding, accepting your problem, that this is my problem, and then we will work together to overcome the problem. That is what we need to work.
Okay. And Dr. Can melasma turns into cancer?
Not really.
Okay.
Yes, basically cancer, the BCCs and SCCs, overall long-term damaged skin is what we can say that can turn into melasma, but melasma turning into is not very common thing.
Mm-hmm. Now, I think you also said that if it could be genetic, right? If my parents have melasma or any of my parents has melasma, there are chances that I could also get it from them. Now, in such case where a person knows that, okay, I'm suffering from melasma, or maybe my, kid will also have it. Anything that we could do to prevent melasma and those genetic or hereditary conditions?
A good skincare routine and usage of sunscreen, protection from sun.
Okay.
You
And
have to
what would
avoid.
be a good basic skincare routine that everybody can follow despite the very hectic schedule?
I'll tell, but and one more thing, a basic skincare routine and usage of sunscreen, and definitely one more thing, which the if the person is a bit worried about getting melasma, then they should always isn't protect themselves from sun. That is one thing. And yeah, basic skincare routine. You have to you have to wash your face. That is most important. At least 3 times in a day. Washing your face because it gets rid of the sebum, dirt, whatever. And after that, after washing your face, you have to apply. If you are, in the habit of applying serums and all, depending upon your skin type, you can. Patients who are having a melasma prone skin, pigmentary skin, they can always use vitamin C based product, glutathione based products, which are very safe for long term use. And usage of sunscreen at least 3 times in a day. And at night time, they have to use some repair cream so that whatever damage has been happening throughout the day is like getting repaired at night. So that is the main skincare routine. Once in a week, if you want to exfoliate, you can exfoliate your skin. There are There are ways of exfoliating. You can do it with the physical method or with the chemicals. You can once in a week or in 15 days. You can obviously to make your skin clear. And avoid, there are not just the main thing about skin is it's not what you apply, what you do to your face, which determine a good skin. What you eat, how you sleep, what you exercise, how is your stress level. That is all. These are the main contributing factors which will affect your skin health, especially the food, because a lot of many a times we just talk about this thing to take, these things to as in we have to take this vitamin, that thing, but we are not talking that kind of damage our skin is being done by the diet which we are following, which we are not eating proper, rather than we are not eating what we are supposed to eat and we are eating junk. So that is definitely affecting your skin, especially patients who have oily skin. There are dairy products, there are gluten filled products, these will be affecting your skin. So, definitely a good exercise will definitely make your skin brighter and will give you good response. And sleep, stress, hormones.
Correct. So good lifestyle or lifestyle modification can actually go a long way in maintaining good, healthy skin, and definitely eating, resting well or sleeping well or doing physical, exercises, etc. They all come together, and definitely de-stressing yourself is equally important. And Doctor, before we wind up the session, any take-home message for our viewers?
Take home message will be the same, that please avoid, as far as diet is concerned, as from skin point of view, please avoid more food rich in glycemic index. Avoid food they are like more oily. Avoid food which dairy and dairy products, definitely, as far as skin is concerned, they are not very good for skin because they are like loaded with hormones. And include protein, good protein, include veggies, include salads, include good source of fats. So this will be for the skin. As far as eating is concerned, you should at least have a good amount of sleep, 6 to 8 hours. You have to exercise at least 45 minutes of good exercise is most needed to maintain a good skin. And skin wise, if we say, don't go for what others are doing. Okay, every skin is different. If you see that any problem areas are there, then definitely consult a dermatologist, get your problem areas corrected. And for basic thing, you can use a good serum, vitamin C based serum, along with good sunscreen, at least 3 to 4 times in a day, and wash your face with a mild cleanser. And at night, just use a good repair cream. That will be like for normal skin, that should be enough if you are eating proper and if you are like following all the lifestyle modifications.
Fair enough. So if we follow a good lifestyle, if we have a good skincare routine, then we are good to go. Still, in case we have or face any issues regarding our skin or scalp, we need to go and consult a qualified dermatologist. Thank you so very much, Dr. Tanuja, for your valuable time. It has been a very informative session for our viewers. It was wonderful hearing you. Thank you so very much.
Thank you. It was a pleasure.
And we really look forward for many more such sessions for our viewers in coming times with you. So thank you very much once again.
Thank you.
Viewers, thank you for your active participation in today's session. Stay connected to our beautiful Spotless Skin page. Thank you. Have a great day ahead.